Hello YouTube, it's now 24 hours since the last video I made about my experience of laser eye surgery, and I wanted to start this video by filling in a couple of gaps I feel I left in my last video. The first one was about my experience meeting the surgeon for the first time. I explained he took me to a room and ran some tests. He was actually very professional. I said he wanted to kind of get on with the business, but he was very professional. He wanted to make sure I was fully aware of what the risks were of the laser eye surgery. He explained that actually doing it on a human being is 95 to 98% successful, whereas in the lab on an artificial eye it's 100% successful. So he phrased it in those terms about the risks associated, and he ran through the other risks. The other thing he wanted to be clear about was that over time everybody's eyes get worse with age, and just because I had laser surgery I wouldn't be immune to that. So that was the first thing. He carefully and he made sure he explained all of those things to me before we proceeded with the surgery. The second thing is, and one of the after effects of the surgery, which I didn't mention, is I've had a kind of a bitter taste in the back of my mouth on and off now since the surgery took place, and I feel that stemmed from the smell I explained while the work was being done to reshape the eye. I still feel like I've got a bit of that taste in my mouth, and I'm hoping that's going to go with time as well. So that's tying up a couple of ends from yesterday's video. So since yesterday's video, I had a reasonably good night's sleep. I had my eye protectors over my eyes, kind of a little bit like this, which were sellotaped down to stop me putting my fingers in my eyes. And I slept relatively well with those on, and this morning when I woke up it was time for my first set of drops. One of the drops is kept in the fridge and the other ones are not kept in the fridge, so I had two sets of drops this morning in each eye, two of the different medications, the antibiotic and the anti-inflammatory in each eye, just one drop of each, and kind of blink those in first thing in the morning. And actually my appointment was very early this morning, 9 o'clock, 9:30 this morning, so I could actually see quite well this morning. I was very impressed when I woke up. I could see everything looked relatively clear. I could read things, look around. I could tell I had quite a good sense of vision. So although it was recommended that I got transport to the surgery today to have my 24-hour checker, I actually cycled. I took my bike. I cycled 3 miles across Cambridge to the centre, and that was absolutely fine. I had my hat on and sunglasses on to make sure that nothing got in my eyes, and it was actually raining, so I was a bit worried about getting water in my eyes, but there was no problem. Cycling across Cambridge, I could see pretty well. And when I got to the surgery, the first thing they gave me was this, which is my lifetime care guarantee. So if there's anything that they can do to help vision in the future, they're going to help. As I mentioned earlier, that doesn't include short-sightedness due to old age, presbyopia or something like that it's called. But it will, if my prescription settles down to be with outside an acceptable range, then if they can correct it with laser surgery, they will retreat me without any extra cost. So that's the first thing on my lifetime care guarantee. I'm going to keep that in a safe place somewhere. Then the optometrist, a lady I haven't met before, she took me to the eye testing room and was first wanting to know how I was feeling at the time, and I explained my vision was quite good. What I've noticed though actually is that I have quite a lot of, I guess you could call it glare. Things seem to shine a little bit, so it's not very crisp yet, my eyesight. So it's quite hard to explain, but there's like thousands of light pinpricks. Like if you look into a shining light and then close your eyes, you'll see the shine of the light in your eyes. I have that on top of the things that I'm looking at, and the optometrist explained this is quite a common thing to occur, and it's because of all the pressure that's been on my eyes, and she said that over the next 2 to 3 days that should go. So I'm hoping that will be gone in the next 2 to 3 days. and now should have much crisper vision. So she did the light test first, so she could have a really good look at my eyes and see how the healing is going. And she said that everything is in the correct place, everything's healing as it should be, and it's looking good from that side of things. She didn't say, oh, your eyes are really too bloodshot, or she didn't see any problems by looking into my eyes, and they can see a lot with that thing. So I was quite happy with hearing that. Secondly, we actually did a short vision test, just the letters on the far wall. That's all we looked at, the letters on the far wall, and asking which is the lowest line of letters that I could read, and with of letters. So my eyes are quite similar at the moment, which is good. And actually, driving standard is 2 lines above that one. So I'm actually reading 2 lines below driving standard at the moment, which I think is really quite good for less than 24 hours after treatment. That was at 9:30 this morning. So very happy with everything so far. In terms of pain today, my eyes themselves, there's no pain. Around the eyes and on my face, I feel slight bruising, like a very, very mild headache, but in my face area. It feels like I might have been punched in the face about a week ago and still have the feeling of that on my face. So that's slightly uncomfortable, and I guess it's kind of not helped by wearing the sunglasses all the time. I'm trying to keep these on all the time. The optometrist recommended I kept them on as much as possible, and I feel it just helps to reduce the amount of light I'm getting into my eyes. Hopefully it's going to be beneficial for my eyes if I keep these sunglasses on, and it helps to reduce a bit the glare which I'm seeing. After my appointment, I've arranged another appointment for 1 week's time, which is when I'll make the next video. And I cycled back. I actually cycled to work today and did a little bit of work, and then I cycled back home when it had stopped raining. So I've been able to conduct pretty much normal business today. When I got home, I actually watched a movie, so I watched a movie today, and by the end of the movie my eyes were feeling a little bit dry. I put in some of the artificial tears just to kind of lubricate my eyes. And I'm just going to keep up with the drops now, 4 times a day with 2 of the drops during waking hours, and then hopefully by this time next week I won't be using the drops anymore. They should stop using those by then. Just show you what my eyes look like 24 hours later. Hopefully you can see that. My wife says that they're a little bit bloodshot on the sides, but she said that the actual centre colour of bit of my eye looks alright. So that's, again, bloodshot eyes, absolutely normal, should be subsiding within a week or 2 weeks, and I go back to work properly in 12 days, so I'm fully expecting to be back at work soon. So there we go, 24 hours later, I can see relatively well. I shouldn't say perfect, relatively well without my glasses, and I have a little bit of the glare, which I'm hoping is going to die down. A little bit of facial headache and taste in my mouth that I mentioned earlier, they're going to hopefully die down. And yeah, really happy with the results so far. In 2 weeks, hopefully this should all be healed. So thank you very much. If you're having laser surgery before then, good luck, and bye bye.